They are actually of the elderly age. I think they are between their 16s and 17s. And we are really happy that if one or two of them is around the 40s, and also their burn coverage is also very huge. It's around 90% of their skin surface is burned, and only two of the patients have 50% of the burns in their skin surface. After the treatment and cured, after over 36 hours of the emergency treatment, since we received the patient, there are 4 more hours to reach the 48-hour golden limits. And in the 48 hours of the shock period, the patients performed stable in their clinical indications. To this morning, there is no patient suffered from the septic shock, and the circulation system for the patient is operating well, but we believe that it is going to cost a lot of the effort to save patients like this. That is my brief introduction for the 11 patients suffered from burns. In my word, I'd like to give the floor to Director Wang. I have give you the introductions of the 11 burn patients, and we have 2 patients suffer from trauma. I'd like to give the floor to Madam Wang. I think the patient suffered from trauma is not only suffered from trauma, they also suffered from burns, but while their total surface of a burn is relatively quite small compared with the burn patient. Currently, they do have the multi-organ failure. There are 11 burn patients, 2 trauma patients. For the 2 trauma patients, they also suffered from burns. While their burn is not as severe as the burn patient, I think the trauma patient suffered from the cerebral trauma and a quite severe damage. When they were referred to our hospital, we believe that they belong to the high categories of the patient. After they receive to our hospital, we have given them whole body evaluations. After 24 hours of the emergency treatment, their body features is in a quite stable stage. I believe the patient will suffer from other different organ failures. After we have taken the 11 burns patient, I think they have all kinds of the comorbidities and complications. They have the thoracic and also the cardiac damages, among other different injuries. And this patient needs our support in our ICUs. They also suffered from the imbalance in their homeostasis. And currently, we have saved all the patients from their shock status. This is a very good indicator. Another part I want to talk about is that many patients have some of the coagulation dysfunctions. And for the patients who are at the lowest levels of their platelet, it's only around 10,000 units. Another features of these patients is that they are of the elderly age. Their average age is around 68 years old, and the eldest of them is 92 years old. All of the patients is relying on the ventilators, and they need to receive the mechanical ventilations. And there is one patient we have provided the emergency invasive intubations. Yesterday afternoon, we have some of the patients suffered from the orthopedics, and they also have some of the other different traumas. And I think this is actually, we have a multiple discipline team to provide the emergency treatment for the patient. We have worked overnight to treat the patient and to evaluate the trauma status and also the burn status of the patient. We finished the evaluation last night. We are under huge pressure last night. We feel that this is a quite hard battle for us to win. What I want to introduce you here is that from the professional perspective, I give you an introduction of the patient. But after the incident of the June the 5th, our hospital has a quite tailor-made treatment plan for each of the patients. We have held several different types of meetings, and during our meeting sessions, we readjusted the plans for each of the patients. All of the departments in our hospital is working really hard. Some of the doctors even stay overnight to keep the lives of the patient. We got all the medical resources that we needed. We really want to thank the local government for the medical support. So from our hospital's perspective, our whole team is going to try our best to save the patient's life. You have mentioned about the tailor-made therapy for each of the patients. What does it refer to? I think the tailor-made plan, precise treatment plan, means to evaluate the situations for each of the patients. For example, if we are conducting a CT for the patient, we also need to guarantee the safety of the patient. The precise medical management refers to a very good system for the patient. We should conduct all kinds of the treatment in the safest manner, and it also includes the precision treatment for the patient. The general treatment plan needs to be tailor-made for each of the patient, but the treatment target for all of the burn patients should be the same. So you mean that the 30 patients all suffered from the threats of life? Yes. Can you give me more introduction for the treatment plans for the burn patient? So how do you control the temperatures in the operation theaters, and how do you avoid the nosocomial infection? Let me give you a general picture about the survival ratios. In 1958, there's a lot of burn patients in China, and our treatment for the burn patient is actually starting from that year. We have over 60 years history of the treating burn patients. We are a country of the socialist society. We believe that all kinds of the technologies in the burn treatment is actually leading, and is in the international society. We have the cutting-edge technologies in treating the burns. But it is for treating this bunch of the patient, I think it's of high risk because they suffered from the high ratios of the burns. So you can imagine that if the patients, 90% of their body surface is being damaged by burns, you cannot transplant other different skins to the burn patient. That is the permanent dilemmas for treating the burn patient. For the treatment of the burn patient, we have go through several different stages. For the first 48 hours, it would be the golden treatment period. And coming next, it is also going to be an infectious stage. You can imagine that if you peel off the skins from a tree, the tree is also going to die because the skin serves as a barriers for the internal and external information exchange. For such a huge burn surface, it is also going to trigger a very severe inflammation. And then the patient is also going to enter into the inflammations and also infection stage. Of course, in that stage, it is also going to see the multiple organ failures. Some of the patients actually suffered from the dyspneas and also lung function disorders, and some of the patients have renal failures. And if we combine all these factors, it's also going to trigger a lot of deaths. For the third stage, for the burn patient, it is also going to be the recovery or the rehabilitation stage. On the third day of the rehabilitation stage, we are also going to conduct the normal operations. We are going to remove all the burn skins, reduce the possibilities for infections. Another part is that how do we cover all this part of the skin? How do we let the skin grow back? It is going to be a quite a long stage. In 2017, there is also an incident in China. One patient suffered from 99% of their skin burns with a depth of 97. Burns actually goes into his hypodermis, and I believe the intact skin for the patient, the total area is actually less than the palm surface. You can imagine that we have taken 4 months to rescue the patient. Currently, the patient actually owns his own windows and he's actually owns his own stores. Basically, the patient can do every single movement in his daily life. That is the reason why this morning I'm actually introducing to all of you. I have rearranged my best doctors to the front line of treating the patient. We believe that after the rehabilitation stage, the patient is going to recover, and the recovery stage is actually going to spend it to 1 to 4 years and even 20 years. If the patient recovered in an early stage, they can come back to the society at an early pace. That is my general introduction. We have talked about the interventions of the rehabilitation physicians. So how many of them are working here? When will they arrive? I think we only have one rehabilitation physician, and he's going to arrive in this afternoon, because in the current stage, we don't need many of them. It is something that we have done in China, and in our whole boarding treatment teams, we have the rehabilitation physicians participate in the early stage. We have added one rehabilitation physician in our team in the early stage because it is going to improve the survival ratios. I think the third stage is also going to occur in the 48 hours or even the 24 hours after the burns. It is being dependent on the scenarios of the patient. I have introduced you the 3 different stages, but I think these 3 stages are overlapping with each other. First 48 hours, the golden time, and then it followed by the infectious stage, and then it followed by the rehabilitation stage. Later, it is followed by the recovery stage. But for the rehabilitation stage, sometimes we need to cope the patient's service with some of the drugs, and we need a coordinated effort to treat more patients. The incident occurred, and it is not something that we want to see. After it occurred, the government has given us a lot of support, and in our local governments, all the patients should be saved with our maximum effort. I hope that the families and relatives and friends of the patient should support us. We should work together to treat the patient. Yesterday, I talked to 7 different family members. They understand the difficulties of your work because of our work, and I was talking to them at 11 p.m., but they really understand our efforts. I think those family members do help us a lot. So the 13 different patients don't have quite stable indicators. So what kind of indicator that we can discharge the patient or the hospital in the coming stage? I think the risk stage for the burn patient is going to last for a long period of time. if there is any incisions of the patient, it might pose a huge risk for the patient. For example, if the patient still have a trauma coverage of a palm size, it is also going to pose a huge risk for the patient. So actually, we have the successful case, but we also have our failure case. And I think if we calculate the patient, the successful ratios as a 50%, and in our practice, I think our successful ratios is around 90%, and it is not included the in-depth burns. And I think the in-depth burns, it has a recovery ratios of 50%. And our treatment for the recovery ratio is around 50%. That is our data. I think our data is better than the US physicians, the German physicians, and the Japanese doctors. That is a quite objective data we have achieved so far. But for the data, we did not include the risk factors, including age. Age is a very huge risk factor. If we add age in, it is going to pose more difficulty. There is a seduction, which were being done by other different countries. For the people who are over 60 years old, plus their total burns surface, if they are over 150, the patient cannot survive. If we calculating the patient's age together with their percentage of the burn area, is definitely going to be over 150%. But with the progresses in the recent years, we are having certain confidence that we are going to treat the patient and recover all of these patients. You talk about the burns and scars. Let me introduce you that for the burns over the level 12, after 40 days, it is going to see the scars. And if the scar occurred after 21st days, it is going to cause the disconfigurations in their patient appearance. This is something occurred. We don't want, of course, we want to save the patient's life. We also want to give the patients their normal life. We want to implant the skins in the patient, reduce the patient's concern. I have not received a single patient which is 5 years old. I think it's a mistake. You have talked about the explosive trauma. Can you give us more introduction? Let me give you the introduction and the 4 different stages of the trauma. It is caused by the different reason. For example, if there's a car accident, if I'm the driver, it is also causing the bumps between the cars is also going to cause a lot of the shock in my body, causing the failures in the lungs. So currently, the burns that we have so far is what we call a compound trauma, multiple reason-induced trauma, which means that during this explosive accident, the patient actually suffered from the influencing factors, including the shocks and also the burns and also explosives. It is also going to cause the patient's thrombosis, among other different indicators, and we believe that many patients have suffered from the explosive traumas, and this is actually a compound injury. The patient is going to demonstrate indicators as coagulations, among other different influencing factors. I don't think that it is quite severe for the explosive traumas. Can you talk about the coagulation function for the patient? Let me give you more information about the burns. It appears that burns is a trauma, but actually it is a disease. You should remember that our healthy status apart from the sub-healthy status. There are two different parts. One is the disease, and another is trauma. So trauma is something occurred in the very early stage and primitive stage of human beings. So trauma is always occurred earlier than the disease. A huge surface of the trauma is going to induce the disease. It is going to induce the multiple organ failure. We have considered this as a compounded trauma. We have transferred the patient into a very comprehensive treatment ICUs. What kind of effort do you take to save the patient? I think all of these patients is in a severe or even critical stage. They are threatened by life at any time. So we have given the patients SOFA scores, and all of them are above 22 points. That is to say, if we don't treat the patient properly, the patient is definitely going to die, and the patient is of high age group with a lot of comorbidities and underlying disease. Today, we see some of the patients and showing the signs of life, but we are well prepared for that. I think the challenge posed by this incident is actually more severe than the COVID-19. When the accident occurred, we have upheld it online meeting. At that time, we did not know how to treat the patient. But at that time, we have already decided that we are going to assign the best doctors in each of the departments to form a special team to treat the patient. And we have also formed a special cross-discipline center. And we have also came up with 4 different emergency treatment plans to categorize different patients into the different categories of the emergencies and provided them different levels of the treatment. The patient might have the infections in their respiratory tract and also in their digestive tract. We are well prepared after the incident occurred. In the afternoon, we are going to take in more patients. Thirdly, we have also excluded all kinds of the possible risks. Our director and the general secretary is actually starting his or her work at 7 a.m. every morning, and at 5 p.m. all of the experts is going to report to the director about the status scores of each of the patients. For each of the patients, they are being cared by multiple disciplines. Of course, the patient is being treated by the burn department and also the ICU department. For each one of the patients, they have their responsible doctors and responsible nurses. That is how we manage each case for the patient. If the patient needs to be referred to other different hospitals, we are going to facilitate the patient with assigned doctors and nurses. I think this is something that needs a cross-discipline effort. We are also going to check the patient's other different indicators, including their cardiac functions and thrombosis. The 48 shock period is going to end in the coming 4 hours. We are going to enter into the infectious stage. How do we better treat the patient in the coming stage? I think Director Luo Qing is going to be responsible for that. The nosocomial infection is actually of the vital importance. Dr. Luo Qing has a lot of ICU experience, and he led us the fight in Wuhan. So I think that you should leave it to the professional hands. Secondly, is about how do we cover the trauma areas to reduce the infections. Of course, we are going to use all kinds of the antibiotics and provide the patient with a lot of the resistance to the external environment. Can you give us one case introduction? The patient is of 78 years old. So the patient has the cardiac arrest when they were sent into the county-level hospital. And the county-level hospital provided the invasive treatment, and after twice of the invasive treatment, the patient still suffered one time of the cardiac arrest. That's the reason they transferred to our hospital. After last night's emergency efforts, the signs of life of the patient is in a stable stage. I think the patient has over 90% of their skin surface burned. They still pose a lot of challenge in our clinical respiratory clinical effort. She needs to take a rest. She actually took. So I think our director Wang, Madam Wang, is a national expert in the lung transplantations during the COVID-19, and she just flew back last night after 2 important lung transplantation surgeries. And last night, we have sent 2 medical teams to Luqiao, where the accident occurred. And there is a patient who suffered twice of the cardiac arrest. So currently, the patient is actually suffered from the ischemia in their brain part and the cerebral part. We have used the emergency treatment for the patient. I think going forward, we are going to suffer more challenges. We actually cannot imagine the patient survive after twice of the cardiac arrest. But somehow, the patient survived, and I think going forward, the treatment procedure is going to be more difficult. Why didn't we transfer the patient yesterday? It is because we try our best to transfer the patient who can be stable during the route transfers. The patient actually finally, after the patient stabilized himself, we finally transferred the patient to our general hospital. I think we have a lot of professional vehicles. I'm actually not responsible for the management of the transfer. Thank you very much. Thank you very much. I'm going to see you later because I have a lot of work to do.